All right, so first let's do the ASIS, anterior superior iliac spine. Yeah, everyone you can move the chairs away so you can come closer. Yeah, come inside. The same thing, like you can come over here. See, I still have space here. I still have space. 站紧一点，站紧可以的。Okay, I'm going to palpate ASIS, which is the landmark on the hip area. Do I have your consent? So you can. Okay, if you don't feel comfortable, you can always stop me at any time. Yeah, give your client the power to take back the consent. Now let's start. So you just put your hand somewhere at the waist, inferior area, and then you try to move inferiorly. Find that this is the iliac crest, right? I'll just demonstrate one side. Okay, demonstrate one side now. So you find that this is the iliac crest. Follow the iliac crest. See how do I move? You have to do the crossway. The iliac crest goes this way, right? So if you move this way, you may lose it. You have to go like this so you don't lose it along the iliac crest all the way. Anteriorly. Oh, it's very obvious, okay? So right here, I can feel this is like a cliff, right? So the ends and starts to see, right? It goes up. So this is the end of the iliac crest. At the anterior side, this is the superior. Anterior superior iliac spine. So right here, ASIS, okay? Now, because this is very superficial bony landmark, usually we don't need to confirm. We already know this is it. But if you want to confirm, what we can do is cross your leg. Yeah, right. No. Cross your leg. Okay. And then try to resist against me. There we go. Here the tendon pops up. This is the sartorius tendon. It comes from a relax. It inserts onto relax. It inserts onto the right here, ASIS, okay? All right, next, AIIS, anterior inferior iliac. This one's more difficult, okay? So what we do is we find the ASIS. We know that we need to follow it, go inferiorly and slightly medial, okay? Probably somewhere here. But we have, like I said, we have soft tissues over here. You may not be able to feel the bone structure, which is the estimate. It's about here. So we want to confirm this. Can you raise it? Yeah, there we go. See, to feel the tendon popping up right here. Relax. See, relax. Let's do this again. There. The big tendon. Relax. So this is the tendon of the rectus femoris, which attaches to the AIIS. So it's at the right here. So where's the ASIS is right here. So I'm going to use 2 fingers to mark that this is ASIS, this is the AIIS, to give you an idea, okay? So this is the, according to his size, okay? For some people, you still have to adjust. You have to adjust the, the distance because of the client's size, all right? And female's different because we have a wider pelvis as well. So probably because the male you have a narrower like a pelvis. So that you see, look at the ASIS and ASIS and AIS, they're kind of not too much medial, but for female, it's more medial because of a wider angle of the pelvis. Okay. Now can you turn prone? Let's try to find the PSIS. No. Oh, okay, yeah. Sometimes. PSIS posterior, we also have ischial tuberosity as well. 在哪？干的转，这个掏我paper towel. Okay, let's first start from. Every time Suleiman helps us to learn, right? So he's the only person who didn't actually see this. All right, so let's try to find the PSIS. Okay, still the same. We need to find the iliac crest, right? So I'll do one side only. So I find the iliac crest. I'll move along the crest posteriorly, and then it starts to descend. It starts to turn and descend. Yeah, all the way right here. Because he's wearing the band right here. See, it's blocking the PSIS, okay? Right here, because the pants right here. So these, you can feel, I can still feel a little soft dish over here. So this is the PSIS, but I'm not sure because if he's willing to, but okay. Maybe next time in the student clinic, okay? Because people watching online, so if you're okay, do you have the people there so people can see? Do you know? So if you can, okay. So right here. So because if he pulls hands up, it's just at around like the band area, right here. So right here. But even if you can see it, you still have to find the crest and follow it. Okay, follow it. See, follow it all the way. Okay, posteriorly and starts to descend and medially. This is about from away from the spine. Like I said, it's about 2 or 3 centimeters away. Okay, right here. It feels like a depression. Okay, rather than a bump. So one on each side. One on each side. Okay. But not, like I said, okay, thank you. Not everyone has the dimple, so you have to palpate them. But with the like a band here, no, it's too thick. It's hard to find it. So you have to remove your remove your underwear a little lower to have access. I need to confirm, you can't confirm because there's no movement. Okay, there's no muscle that moves this area. Like I said, if you want to palpate, you want a privacy, you can pull up the curtains, okay, with each other to start the palpation, PSIS. One more thing is the ischial tuberosity is also required for palpation. Then you have to turn this way, yeah. The ischial tuberosity is a sitting bone. It's the hamstring that attaches to. So how do we find it? We will use the gluteal fold. The gluteal fold? It's just right here, the gluteal fold, okay? So what we do is, once we find the gluteal folds, pay attention to our hand. We put our hand at the gluteal fold, and then we push into it. You can feel the bone right away. You can feel the bone right away. Okay. So right here. So to confirm it, you can ask the client to lift your leg up. There you go. The tendon of the hamstring pops up. Okay, relax. Okay, so you should feel the tension of the tendon from the hamstring as the client do the hip extension. Is that clear? Yeah. So the palpation for this, we only need to do the iliac crest, ASIS, AIIS, PSIS, ischial tuberosity. Okay, for pelvis. Now for the femur, not yet. Femur, we need to palpate the greater trochanter. So greater trochanter, how do we find it? It's on the lateral side of the femur, proximal. Not here, it's very proximal. So we have the client's knee flexed. And then what we're going to do is internally, laterally rotate. Now you can feel the greater trochanter moving. So it's moving under right here, moving under your finger. Just go to this right here. Here is a bump. It's a big bump. This is the greater trochanter. Okay? I'll say it again. How to perform? Very simple. Greater trochanter, easiest. You put your hand on the left side of the hip, right? And you flex the client's knee. Do internal, external rotation. You will feel the bone moving under your finger. Just move here. Right here. This is a big bump. This is the greater trochanter. That's it. So far, let's see. ASIS, AIIS, PSIS, ischial tuberosity, greater trochanter. Practice the palpation. Each other. Okay? For girls and the girl. Thank you. Let's sanitize this. Oh, sorry. What's the second? Gloria.
老也不养黑人。
谁都知道这个梗。我不知道什么名字，我也不知道。为什么不是小动物吗？他们都很活。对，他们在活。就啊，这边的人啊，也可以这么 grab。
给你开美颜。
都好的。收脸，比起张脸。
你把帽子戴上。
不像你们这个是。
你这有屎。So if we need to find ASIS, we need to put our finger on the client's waist, and then we move clearly and find the iliac crest right here. Right? So it's the iliac crest. And then let's say I'll use this side. So we move along the iliac crest anteriorly. See that? At the very end, right here. So it just goes off the cliff now. So this is the ASIS. Can you find this? Right here. Right here. See? PSIS on both sides. Okay. So ASIS, and then if we want to find AIIS, we use ASIS as a landmark with a reference. We move it inferiorly and we start to move inside inferiorly. All right, so let's say, I think, yeah, it feels like here. I would like you to lift your leg up. There you go. Okay, relax. Once you do that, I can feel the tendon pops out from it. We do this again. And there you go. So the tendon right here. Okay, against me. There you go. The tendon right here. Oh, okay.
好长的是头那儿是吗 ？Yes, OK.
好吗？
是这样。
So that tendon tells you that the ASIS is there. Actually, because it's like I said, it's very hard to actually feel the bump unless this person is very skinny. You can see November class one of a girl. The AIS is very obvious. Yeah, I can find AIS, and even the PSIS feels like a bump. It's not a ditch because she's very, like I said, there are individual differences. Okay, so this is the AIS easy. Now, can you flip over? Let's do the. Oh, maybe yeah. So for the PSIS, like I said, again posteriorly, let's find the iliac crest. Right. We will move our finger along the iliac crest posteriorly, and then it starts to descend. Oh, right here, your PSIS is also just right underneath right here. Feel a soft ditch right here. This is the PSIS. Okay? 很明显的。PSIS 是很好找的啊，很明显。OK。就是你的手摸到那里，感觉 so feel like a 用我的就比较坑，有个小坑。但是可能有的人的骨头比较大，可能看不出来像骨头，但是大多数人摸起来都是一个 ditch， 一个 soft ditch。OK。Okay, now let's try the greater trochanter. Greater trochanter is like it's on the side of the femur. So we put our hand, just generally put your hand on the lateral side of the hip, right? And then we flex the client's knee. Yeah. So flex the client's knee by internally, externally rotate the femur. And then right here, you can find this bump, big bump. This is the greater trochanter.
PSIS 呢
？PSIS 摸不到。摸不到。Okay. All right. See, right here. You won't miss it. Right here.
没有那么靠上，那大腿。
Not here. This is the iliac crest. Too high. Right? So instead of tuberosity, find the gluteal fold. It's the same thing. Put your hand at the bottom of the gluteal fold, and then push your hand in. Okay? Press it in. Palpating the pelvic. Don't palpate like that. It's a gluteal region. That's creepy. Okay? How to find it? Put it in like this. This is to find it. Okay?
It's creepy.
Okay, so start practicing palpation. Thank you. Just
Thank you for your